Welcome to the Patient Care section of the National Health Careers Association Certification Exam. The objectives for this lecture will be for you to understand how to obtain a patient history, educate your patient about their EKG procedure, applying the electrodes themselves, which of course we'll also do in class, discuss some differences in some special cases, discuss HIPAA's impact on your practice, and when we get there, we'll discuss it in more detail. Recognizing the signs of cardiac compromise, responding to complications that may occur during the obtaining of an EKG, and then listing normal vital sign ranges for a given age group. So the first thing we need to do is we need to prepare the patient. In this, we need to gather the patient's history. Now, in real life, in practical applications, this is not usually something that the EKG technician needs to do, but it's something you might need to do if you were working, say, in a cardiologist's office. A patient history can include social, medical, and surgical histories, as well as current medications. You'll remember that in the Holter monitoring videos we've seen, every time the patient has been asked to bring a card with their current medications on it. Social history can include things such as, does the patient smoke? Do they have a background of alcohol or drug use? Any sort of stress they may be experiencing? Are they getting regular exercise, and what are their eating habits? Medical history will include previous medical conditions, any sort of past heart attacks, strokes, heart murmurs, and the like. Also, if they have any chronic conditions, such as COPD or chronic obstructive pulmonary disease, this includes emphysema and bronchitis, diabetes, hypertension, and other sorts of chronic medical conditions. You should ask female patients if they are pregnant and refer them to their physician if they have any concerns about their babies and getting an EKG. Ask about allergies. Latex has pretty much been replaced with other forms of materials, but a latex allergy is something that still might be important for you as far as the patient interacting with them is concerned. Ask if they're experiencing any symptoms right now, such as chest pain, difficulty breathing, lightheadedness. Those things that we've talked about a little bit in stress testing that would stop a stress test. In continuing to gather the patient's history, we'll also get a surgical history, documenting all surgeries, when, where it was performed, and any complications. Now, no, we're not talking about the tonsillectomy that the 60-year-old patient had when he was 7 years old, although a lot of patients like to talk about those sorts of things. They really wouldn't be relevant, but if they mention it, it should be written into the record. Ask about histories of valve replacements or any cardiac procedures such as stents, any bypass surgeries. Do they have a pacemaker or a pacemaker defibrillator implanted, or any childhood cardiac surgeries? Now again, usually when the EKG technician receives the order, these sorts of things are already known. But as I've told you in class, you do know how to interpret an EKG. Even though it isn't your job to tell the patient what their EKG says, it can be uncomfortable to be surprised by pacemaker spikes on someone's EKG if you weren't expecting them. And then here also, we want to get a medication history, document all medical allergies or adverse reactions in the past, document all their medications that the patient is taking now with their name, the name of the medication, the dose, and how often and what time of day it's taken, and make sure that they've taken them appropriately unless their physician advised them not to take them before the test. Ask about any over-the-counter remedies that they might be taking or herbal supplements and vitamins. Some herbal supplements can create changes on EKG. So again, that wouldn't be something you would necessarily know to look for as an EKG technician, but having that on their medical record next to the EKG can help the physician determine whether it's an herbal supplement or something else that might be causing some sort of change. Also, you need to ask about birth control and erectile dysfunction medications, unlike what it says there on the slide, medications. Not exactly sure what that's supposed to mean, but obviously I left an N off there. Next, we need to educate the patient. Let the patient know what to expect during the test. Use any materials that might be available at your work site. I know here in Rochester at Mayo Clinic, there's a nice little threefold brochure that patients are given before they have almost any test. Sometimes it's even a complete booklet that will tell them what's going to happen. Oftentimes it's sent to them in the mail. Again, I don't know from workplace to workplace how that'll happen. Here's how you can explain an EKG to a patient. It allows the physician to assess the electrical activity of the heart. It's non-invasive, painless, and takes only a few minutes. You do want the patient to go ahead and remove electronic devices from their pockets. As I've said in class, the NHA certification exam takes the most conservative route possible. Do we really think that a cell phone in a pocket is going to interfere with an EKG today? I'm not sure, but why take the risk? Have the patient lie flat or with their head slightly elevated, and don't make contact with the bed rails. You've seen that before. Instruct the patient to remain as still as possible during the test, and for a 12-lead EKG where it's taking a snapshot, that usually lasts only about 10 seconds. We're going to learn more about the 12-lead EKG machines and how they work later on in our course. If the patient's being placed on a Holter monitor, you can explain to them that this allows the physicians to assess electrical activity of the heart over a longer period of time and while the patient goes about normal activity. It again is non-invasive and painless, and the patient will wear the electrodes for 24 to 72 hours. You should expect that the physician would have said, Mr. Smith, we're going to put a Holter monitor or we're going to monitor your heart for X number of hours. So that shouldn't be a surprise to the patient. Patients, again, should remove electronic devices from their pockets and wear loose-fitting clothes. Women may wear a bra. The patient should go about their normal daily activities, except they cannot shower, swim, or any other activity where the chest monitor might get wet. So your patient will look right at you, I'll guarantee you, and say, well, what if it's pouring down rain? Well, try to keep it from getting wet. Instruct the patient to record events in their journal as they've been instructed by their physician. I know that the video that we watched in class the other day talked about every time you go up the stairs, you need to record that. That's a little specific. Just make sure that they understand that the instructions from their physician is the one that they should follow. Next, we're going to talk about stress testing. Stress testing, again, I've described it to you, and there's going to be a picture here in just a little bit. It determines how the heart functions under an increased workload from some sort of exercise. It usually takes about 10 minutes to complete. The first thing you do is you put the patient on the 12-lead EKG and then take a recording so that we have a baseline. Before they begin to exercise, this is what their heart was doing. The patient then will exercise on either a treadmill or a stationary bicycle, and they'll continue to do that until a target heart rate is reached, or the patient begins to become symptomatic. They become ill, or they become extraordinarily tired. I can tell you, I've told you before that I've had a stress test myself, and the target heart rate for my stress test was 138 beats a minute. So when I reached 138, that's when they backed it down. The patient should come into the office or wherever the site of the stress test is going to be wearing comfortable clothing and shoes. Obviously, if they're going to be walking on a treadmill or on a stationary bike, we want them to have shoes on. Generally, and again, this is straight out of the study guide for your national certification test, no eating or drinking should be allowed for 3 hours before the test, but your work site may have different standards for that. Continuing on in stress testing, The patient should continue their normal medications unless their physician instructs them otherwise. So in other words, if they're coming in for their stress test at 10 in the morning and there are medications they usually take at 8 o'clock, they should have taken those unless their physician told them not to. Tell the patient that they may stop the test at any time if they begin to feel ill. It's up to them to look at you and say, I can't go any further, I don't feel well. After exercising, the patient may need to remain on the monitor as the EKG continues to be obtained. Sometimes they not only want to see what happens to the heart while it's exercising, they want to see how well it recovers from the exercise period. Potential complications during stress testing can include low blood pressure, abnormal heart rhythms, and these should usually resolve when the exercise is stopped. Obviously, if you feel uncomfortable about the situation, you should go ahead and call for assistance. The next type of EKG monitoring that you might be involved in is telemetry monitoring. Now, in telemetry monitoring, we're using it to continuously monitor the EKG, usually in an inpatient setting. It's non-invasive and painless, of course, all EKG is. The EKG is monitored potentially remotely. We've talked about how the VA facility in Tomah, Wisconsin is monitored from a facility in Minneapolis. And alarms can sound when dangerous rhythms are detected. If EKG electrodes fall off, the patient should be advised to notify the EKG tech or other hospital staff. Now remember, this is a patient who is in a hospital room, so it's a little bit different than that person who's taking a Holter monitor home. Also, you should advise the patient to notify the hospital staff if they become ill. But again, this is an inpatient situation, so I think they're going to be hitting their nurse call lights anytime they don't feel well. But again, it is your job to advise the patient to notify them. Turning away from educating our patients, let's talk about how we hook them up. You've been doing this, you know what you're doing. Limb leads are used in telemetry and bedside monitoring, such as in an emergency department when somebody's there, getting checked out for whatever reason. They've come into the emergency department. You know that the textbook limb lead placement is shown here on the left, and that our more practical way of doing it is shown on the right. Although we tend not to put the leg electrodes down on the thighs, we put them up on the upper part of the abdomen, the lower part of the chest. So again, you know how these go, no big deal there. Next is 12 lead, and here's a picture of a gentleman getting a 12 lead EKG obtained. There he is laying flat on his back with his head slightly elevated. Hopefully he's nice and comfortable. We want to get a nice baseline monitoring, nice baseline there. And there's the American Heart Association resting EKG or ECG electrode placement. Remember that also goes along with the placement of the limb leads that you see on the left here. And if you look at the patient on the other slide, here, there are the limb leads. One of them there is shown on his left arm, and then the other two are shown down there on his shins. Hopefully you can see that there. Next, lead placement for Holter monitoring. Like I've told you, I showed you those pictures, even the picture of a cat that's on a Holter monitor. They can be placed almost anywhere. This is textbook, the diagram on the right. You'll notice that now there's a brown electrode right in the center of the chest, and that's that V1 electrode. But as I've told you in class, the various types of configurations that there can be for lead placement for Holter monitoring are extraordinary. There's just a lot of them out there. So you'll be taught how to do that when you arrive at whatever work site you go to. Next, here's a picture of a patient undergoing stress testing. So there he is on the treadmill. He's hooked up to a 12 lead EKG. And the configuration for the leads in a stress test are kind of a combination of what we do in most of our traditional limb leads for telemetry and bedside monitoring, along with the 6 precordial or chest leads. So you can see that there on the right. Turning to special populations, there are times when pediatric patients who are less than 2 years of age will have an order for a right-sided 12-lead EKG to be obtained. As we grow, when we're very small, when we're infants, and then as we go into our toddler years, the heart's orientation as we grow, it begins by being oriented more towards the right. Now, you'll get a specific order to perform the right-sided 12-lead, to place the chest leads in a right-side configuration. And it's basically just a mirror image of the normal. So in this case, V1 is going to be on the left fourth intercostal space, mid-clavicular margin, V2 on the right side, and then 3, 4, 5, and 6 will go down the right side of the chest, just like they do on the left side of the chest in a normal lead placement. Again, I have not done this in my practice as a paramedic. It hasn't been something that's come up. But if you're in a practice, or let's say you get a job in a hospital with children or with pediatric patients who come in for more complicated conditions, you might see this. And again, this is right out of the study guide for your national certification test. So again, pediatric patients less than 2 years of age may get an order for a special right-sided 12-lead EKG. Another variation that might be done is posterior placement. And again, this is right out of your study guide, so you can think, I may see something like this on the test. There is something called V7, V8, and V9. V7 is in the fifth intercostal space, right behind V6, in the posterior axillary line. So you have V6 in the mid-axillary line, right in the armpit, right down the center of the armpit. V7 goes to a line that's just behind it in the same intercostal space. V8 is at the mid-scapular line, which pretty much lines up with the mid-clavicular line, more or less. And then V9 goes just to the midline, towards that. So between the scapula and the spine. These are becoming a little more popular, especially, and we'll be learning this in more detail later on in the course, especially if the patient is having a heart attack in the lower or in the back, the lower part or in the back of the myocardium. This can give a clearer picture of what's going on. Next, let's talk about cardiac compromise. Cardiac compromise, of course, means that the heart is no longer performing its job up to the point that it's meeting metabolic demand. Signs and symptoms can include tachycardia, fast heart rate, or bradycardia, slow heart rate, pallor, which is pretty much just a really ugly color, how would I put it? Almost like grayish, a grayish tone in their skin. Diaphoresis is sweating. A low blood pressure. Generally, people who have cardiac compromise, if they had a high blood pressure before, when they begin to go into cardiac compromise, their blood pressure begins to drop. They may also complain of difficulty breathing. One of the first signs can often be anxiety. They suddenly just don't feel right and they get nervous. They may also become confused. Confusion is a lot different than anxiety. A person can be anxious walking in the room for a stress test. That makes sense, right? Their doctor wants to see what their heart's going to do under distress, I guess you could say, or under stress. Confusion kind of turns a corner. If the patient no longer has a real good idea of where he is or things like that, that's telling you something's going on and you need to stop that test really fast. Cyanosis is bluish skin. I would say that pallor looks worse than cyanosis. If you see cyanosis, you've got a bad situation. Don't let it go towards pallor, which is kind of a grayish color, a dusky color. Obviously, chest pain or a sensation of tightness in the chest. Nausea, vomiting. Obviously, if you're giving a patient a stress test, that's not when, if they begin vomiting, obviously you want to stop the test. And then finally, weakness or fainting. Now, some patients may feel a little weak during the stress test, but what we're talking about here is someone who suddenly has to hold onto those handrails just to stand up, or who can no longer hold their own head up. Those would be signs to me that I want to stop that test. Next, let's talk about HIPAA. HIPAA stands for Health Insurance Protection Accountability Act, I believe. I'm almost positive on that. Health Insurance Protection Accountability Act. HIPAA has defined for us what is protected health information, or PHI, and it restricts its distribution to persons who have a direct role in the patient's care. PHI would include anything that could tie an individual person to an individual record. So a record that has the patient's name and then anything about them on it would be protected health information. Now, people will ask, does that mean that in the cafeteria I can't talk about any patients I ever see? Well, a HIPAA officer in a hospital will say absolutely never talk about anything that you do with a patient in an area where anyone else can hear, even amongst your coworkers. But at the same time, as long as you talk in general terms, you want to tell someone about an interesting case that you had in a stress test. Just make sure that you don't talk about the gender of the person. Use gender-neutral language. Don't specifically mention their age. Don't specifically mention their name. But if you want to talk about just broad, hey, we had an interesting case, this is what happened, that's okay. But you should follow whatever your employer says to do. And I'm telling you now, when you're brand new, just don't talk. When you're a brand new healthcare practitioner, just don't talk. You'll get a feel for what's okay and what's not over time. I'm also posting a brochure on D2L with some really good information on HIPAA. It's a HIPAA primer, and when I saw it, I said, yep, that's what these guys need. It really does give you a good indication of what is protected health information and what is okay to talk about. Next, we're going to talk about monitoring our patient during stress testing. We want to watch the patient for abnormal vital signs, arrhythmias, and signs of cardiac compromise that we talked about before. Now, the way we know whether or not the vital signs are becoming abnormal is that you're going to take a set of them before you start the test, just like you take a baseline EKG. So if their blood pressure when you began the test is 140/70, and as they take the test, their blood pressure begins to drop and suddenly it's 90/40, you know you've got a problem and you need to do something. You need to stop the test and get some assistance. We want to watch the EKG primarily for PVCs. Quite frankly, as the heart rate begins to climb, and again, like I told you, in my particular case, they wanted my heart rate to get to 138. It's going to be pretty hard to see PACs or PJCs in there, but PVCs will still stand out. We also want to watch out for ventricular tachycardia, supraventricular tachycardia, but what's interesting there, of course, is in my case, they wanted the heart rate to get to nearly a across the board supraventricular tachycardia heart rate, right below 140. And then also heart blocks. But most heart blocks occur in a case where the heart rate begins to slow. So if they're exercising, you would expect their heart rates to go up. If it suddenly begins to go down, that's a reason to stop a test. You'll learn more about T-wave inversion and ST segment changes later on, but these are signs of ischemia. We'll talk about these in class as far as what they look like on EKG. Finally, we're going to talk about responding to complications during stress testing. Most of the time, if you stop the test and allow the patient to rest, any sorts of side effects will resolve with a little bit of rest. If you're feeling nervous, call for help. If a low blood pressure does not improve, have the patient lie down with their legs elevated if they can. Sometimes patients don't want that, especially right after they've exercised. And remember, we might be talking here about an elderly patient who isn't used to being stressed this way. Oftentimes, they either don't want to lay down, and if they do lay down, they certainly don't want their legs elevated. They won't tolerate that very well. And flat out call the physician or whatever the help or assistance that's available in your facility. And again, you'll be trained in that when you get there. Rarely, patients may suffer cardiac arrest that will require CPR AED. You've been trained in that. You got a card in your wallet that says so. And of course, if there's any concern at all, if you're an EKG technician who's more or less working alone, maybe with another EKG technician, if either one of you are uncomfortable or concerned about anything that's going on, report that to the proper higher medical authority, such as a physician, or in some cases it may be a nurse. Well, thanks for your attention. We'll be talking about vital signs as far as the normal numbers in class. And so that'll be the last objective for this. We'll talk about those in class later on. Thanks for your attention, and email me if you have any questions.